She couldn't walk straight. She bounced into the walls and different stuff, and then she was slurring. It wasn't.
Yeah,
and she's very articulate.
Yeah.
Always has been.
And I couldn't talk properly as well.
Right? And great big huge black circles under your eyes.
Yeah, like really
and she
big.
was getting skinnier. Like during the day, she noticeably lost weight. A lot of weight.
A lot.
Carista was experiencing severe hypoglycemia, which happens when your blood sugar gets too low. Thankfully, her family got Carista the immediate treatment she needed. After a lengthy recovery and learning to cope with her daughter's type 1 diabetes, the family reached out to Variety, who provided Carista with a continuous glucose monitor to regulate her blood sugar level. Carista is one of thousands of children in BC who have type 1 diabetes.
This is the sensor.
And until recently, many of these families would be unable to afford these expensive CGMs on their own. That's when Variety stepped in and provided this essential piece of technology to improve the lives of kids with type 1 diabetes and their families. Recently, the provincial government has shifted policy and begun providing Pharmacare coverage for CGMs, but with a caveat.
So when the government announced its support, it was revealed that the families would be out of pocket for certain amounts for the deductible that they would have to pay to get to the Pharmacare maximum. So Variety has stepped in to cover the deductible up until the family maximum for that family, so the family would not be out of pocket.
Now, with the government covering the cost of CGMs and Variety assisting with the Pharmacare Deductible for approved type 1 diabetes supplies and insulin, families can rest assured knowing that the financial burdens of monitoring and treating their child are completely covered.
And joining us to discuss the changes in funding for children with type 1 diabetes is Dr. Clare Henderson. Doctor, first of all, remind us, what is type 1 diabetes?
Sure. So type 1 diabetes is when our immune system basically makes a mistake and becomes confused. It attacks the cells in our pancreas that are responsible for making insulin. So insulin is something that's really important for our body's metabolism. And often I describe it as, if you imagine taking a car to a gas station, you need to be able to open that little door on the side of the car to get the fuel into the tank. So that is exactly insulin's job in our body. For all of our cells, insulin is what we need to open that little door so that we can take the fuel, which in our body is glucose, to get it into the tank that runs all of our cells. Without insulin, as you can imagine, if that door stays shut, the vehicle's there, but we can't run it. And so what happens is the glucose builds up in the bloodstream. That's diabetes, and that's when we have to go on insulin to replace what our body no longer makes.
And doctor, what are some of the risks for children with type 1 diabetes?
So from a medical perspective, there are short-term and long-term risks associated with your blood sugars being out of range. So when our body's not making insulin itself, it's much harder to regulate our levels day by day. And so families work very hard 24/7 to try to keep blood sugars in range as much as possible. On top of that, though, I think it's really important to emphasize that diabetes has such a profound impact on the life, not only of the child, but also of their siblings, their parents, because diabetes touches every part of our life. So if you imagine even something as simple as a sleepover, normal childhood experiences that we can probably all remember, planning for a sleepover can be monumental for a parent because they have to be able to manage their child's blood sugars and feel that things are safe. So something like a continuous glucose monitor can just make a huge difference in all of these little pieces of the child and family's life.
What was the reaction from BC Diabetes when the government announced it was going to provide funding for those monitors?
Oh, we were thrilled. Absolutely thrilled. I mean, CGM is just a game changer. It completely changes what living with type 1 looks like. And we just want everybody to have access to that kind of technology.
Now, Variety changed strategies and is now funding type 1 diabetes supplies for children to cover gaps in healthcare. That has to be a huge boost, but there are also other expenses involved.
Yes, exactly. Type 1 diabetes is very expensive. So to give a sense of the typical costs, if you wear a continuous glucose monitor, that's about $10 a day. If you wear an insulin pump, that's another $10 a day. And then insulin itself is about $5 a day. So even if we look at those core elements without other pieces that are also involved, you're looking at $25 a day or more than $9,000 a year in cost. So if a family has a deductible for Pharmacare of a few $1,000s, they're going to be out of pocket a few $1,000s in expenses before they see that coverage kick in.
Which would be absolutely horrible if Variety didn't step in to support these families. Dr. Clare Henderson, thank you so much for your time and your perspective on this.
Thank you so much for having me.
And if you'd like more information on how Variety's grant program for children with type 1 diabetes works, please go to variety.bc.ca. And while you're there, click on the Donate Now button or call 310-KIDS. And remember, if you donate during today's newscast, your contribution will be matched by John Dornbosch of Dams Ford Lincoln Sales and Mike of MSA Ford Sales. Thank you so much for your support.